Hi, this is Dr. Bob Dannenhoffer. I'm the Douglas County Public Health Officer, and this is our update for March 13th. It's now about noon, and so everything I know is correct for now, but things are changing very quickly with the status for COVID-19. We've gotten a question about social distancing, what that means. Social distancing is a way to decrease your risk of infection. So respiratory viruses travel in droplets from the person who has it to the person who would receive it. These droplets are small and don't last very long. They usually stay in the air only for 3 to 6 feet and then fall to the ground. Social distancing is a way to decrease your chance of collecting one of these droplets, and the way to do that is by avoiding contact with people, especially lots of contact with people, and especially with contact with people who are making a lot of droplets, especially people who are yelling, screaming, sneezing, or coughing. So the best thing you can do is just decrease the amount of times that you would get close enough to somebody to be within 3 to 6 feet. So what I tell people is put your arm out, and if you can touch them, that's the distance we're talking about. So there are some things that are relatively low risk. So for example, if you go to the grocery store with your cart and you pass in the aisle with somebody else, you may get close for a second, but you really need to be really is not a high risk thing. However, if you're sitting next to somebody on the bus who's coughing or sneezing, that would be a relatively high risk thing. So still, our recommendations are increased social distancing, especially for vulnerable groups. That would be elderly people and people with underlying conditions. Our second question is, what do you do? Who do you call? Do I call my doctor? Do I call 911? And I think during this time I would use the regular information I would have given you a month ago. If you're sick but not critically ill, please call your doctor. They know your history, they know what's going on, and they can advise you on what to do. I would save 911 for those times when you really need to get to the emergency room. That is, if you're turning blue, fainting, severely short of breath or something like that, I would call. I don't think we're going to see very much of that with COVID because COVID is a relatively slowly progressing illness. But still, the same good advice I would have given you a month ago is the advice I give you now. Save 911 for the people who need it. So one of the most common questions we get is when COVID-19 tests will be available in Douglas County. This is one of the most common questions we get in Douglas County, and I'll bet one of the most common questions throughout the country because the testing situation is still certainly not optimal. At this time, you can only get a COVID-19 test through your healthcare provider. Tests are currently being processed by the Oregon State Public Health Lab, but there's a growing number of commercial labs like Quest and LabCorp that are offering tests, but they're still not widely available. There is not yet an established timeline for receiving test results. There are very few outpatient clinics in Douglas County that are offering testing at this time, but I will tell you that our community health partners are working very hard at this time to make it easier for you in Douglas County to get testing. Thanks again for that. I would like to tell you that we're having a Facebook Live event tonight at 6 o'clock where we'll answer questions like these and many others. So please join us on Facebook Live. You can get there through the Facebook page for Douglas Public Health Network. Again, this is Dr. Bob Dannenhoffer, your County Public Health Officer. Thank you.